Welcome to the Deep Dive. Today, we're tackling a really fascinating and maybe, a little unsettling trend. Mental health AI chatbots. You probably think of mental well-being as, deeply personal, something needing that human touch.
Right.
Yet these AI tools, they seem to be popping up more and more. So for you, if you're keen on getting quickly up to speed on important stuff, this is definitely one to watch.
Absolutely. And it's not just some niche thing anymore. It's moving fast.
Yeah.
Yeah. So our goal here in this deep dive is to really try and understand what these AI tools might offer,
Okay.
but also, and this is crucial, what the potential problems and limits are. We're looking at the research, expert views, the whole picture.
Okay, so the idea of turning to AI, code and algorithms for mental health support,
Yeah.
it does feel like a pretty big shift.
It really does.
Our sources are definitely pointing to a real increase in using these chatbots, but also things like facial recognition for diagnosis and even treatment.
That's right. It's expanding.
So what's actually driving this? Why now?
Well, a huge factor is just the massive gap in mental health care access pretty much everywhere.
Right, the access problem.
Exactly. I mean, the World Health Organization, they estimate that globally, the median is only 13 mental health workers for every 100,000 people.
13. Wow, that's really low.
It's incredibly low. So that lack of human professionals creates this huge unmet need, and, well, technology is stepping in or trying to.
And I guess things like the pandemic didn't help.
Not at all. That definitely amplified things. We saw big rises in anxiety, depression. It just put more strain on the system.
That makes sense. So the promise of AI being scalable and always on, it must seem incredibly tempting, even with the risks.
It does. And think about the U.S. specifically. Sources say over half of adults who could use mental health support. They don't get it.
Over half. Why is that?
Often it's down to cost. Or, the stigma that unfortunately still hangs around mental health issues.
Right. So these virtual options.
Yeah.
They seem cheaper, maybe more private.
That's the appeal. Always available, potentially more affordable, maybe less intimidating for some people than walking into a clinic.
So we're seeing more apps offering chatbot counseling, CBT, that kind of thing.
Exactly. And CBT, just quickly, is cognitive behavioral therapy. It's about identifying and changing unhelpful thought patterns.
Okay.
The fact that AI can deliver some of that, making it more widely available, is a big part of the push.
And it's not just about access, is it? You mentioned something about adaptive interventions.
Yeah, that's another potential plus. The idea is the chatbot learns from your interactions. It sort of adjusts its responses over time. A bit like how a human therapist would tailor things based on your progress.
Okay, interesting. Like personalized AI therapy.
Kind of. And, continuous monitoring is another aspect sometimes mentioned.
So this is where it gets really interesting, because it's not just theory, right?
Sure.
Our sources point to actual studies suggesting these things might work, at least sometimes.
Well, yes, there is some research. For instance, a systematic review found that chatbots could actually reduce symptoms of depression and distress.
Really?
Yeah, but the key phrase there is often short-term. Still, it's a notable finding.
Okay, short-term reduction, that's something.
It is. And building on that idea of AI analyzing language, there was this other pretty fascinating study.
Go on.
They used AI to crunch through millions of real therapy session texts.
Millions, wow.
Yeah. And it was able, apparently, to predict things like patient satisfaction and even clinical outcomes with, some degree of accuracy.
It's surprising. How?
Well, presumably by picking up on language patterns, sentiment shifts, things like that. We're also seeing AI used to try and spot early signs of major depression.
How did that work?
By looking at really subtle things like micro-expressions on your face when you unlock your phone, or even the rhythm and speed of your typing.
Seriously, typing patterns.
Yeah, it's like the AI is picking up on these tiny behavioral signals that maybe even we don't notice consciously.
Huh. Like reading our digital body language.
Sort of, yeah. And then there's that work from Northwestern University researchers.
Right. Tell me about that.
They built an AI model that estimated the likelihood of self-harm. And it was based on questionnaires, but also these behavioral signals we just talked about.
And how accurate was it?
Apparently quite high, something like 92 out of 100 accuracy in their study.
Wow. That sounds like it could be genuinely useful.
The researchers hope so. They imagine specialists may be using it to help prioritize who needs an urgent appointment, or maybe even down the line, for use at home.
But that would need more testing, presumably.
Yeah.
Clinical trials.
Oh, absolutely. Big disclaimer there, pending further validation. But it points to the potential for early intervention.
It really does. A powerful tool, potentially.
Definitely suggests it could be a valuable aid. But, and this is a big but.
Here come the warnings.
Exactly. This is where the experts really urge caution. Because while those benefits sound good, our sources raise some really critical concerns, major limitations.
Like what? What are the main worries?
Well, therapists point out the obvious. AI just doesn't have human skills. It lacks the depth of training, the years of real-world experience, the intuition a human therapist develops.
And especially maybe the newer generative AI, the
Yeah.
stuff that can kind of make things up.
Precisely. That unpredictability is a huge issue. The potential for misinformation, for biases baked into the data it learned from, it's all there.
And we have that really stark example, don't we? Estelle Smith and Woebot.
Oh, yeah, that one. It's really chilling, actually. She's a computer science researcher, right?
Yeah.
So she's testing Woebot, and it apparently responded okay when she directly mentioned suicidal thoughts using the keywords.
Okay, standard protocol maybe.
But then she described a real intrusive thought she had linked to her climbing hobby, the sudden urge to jump off a cliff.
Which is obviously very serious, even if intrusive.
Absolutely. And Woebot, it just completely missed the mark. It actually encouraged her. Said something like, it was wonderful.
Oh.
Seriously. It's a stark example of AI recognizing words, but having zero understanding of the underlying human emotion or context.
Terrifying, frankly.
Yeah.
A tool meant to help doing the exact opposite.
It really highlights the danger. And Richard Lewis, a psychotherapist, he had similar issues with Woebot.
What did he find?
He felt it just didn't grasp any nuance. It would strip the emotion out of what he was saying. And it kept suggesting he reframed negative thoughts in ways that felt really simplistic, kind of dismissive. He made the point that, therapy isn't always about instantly fixing bad feelings.
Right. Sometimes you need to actually sit with them, understand them.
Exactly. Holding those difficult emotions is part of the process, not just papering over them.
I actually had a small taste of that myself. I tried an app called Airkick when I was feeling, just really overwhelmed one day.
Yeah. What was it like?
The advice was just incredibly basic.
Yeah.
Like, have you considered taking up some hobbies?
Not exactly tailored insight.
Not really. Now, their co-founder did say the app isn't trying to replace humans. It's about making help more accessible, which is fair enough.
Sure, accessibility is the goal.
But it still highlighted that gap between a generic suggestion and, the kind of personalized support you'd hope for.
And these individual experiences, unfortunately, they scale up to bigger problems, too. There was that tragic case in Belgium.
Oh, the man who died by suicide after talking to a chatbot.
Yes, that one. And also the National Eating Disorders Association, NADIA, they had to suspend their AI chatbot, Tessa.
Why? What did Tessa do?
It apparently started giving out harmful dieting advice, which for an eating disorder organization is obviously the last thing you want.
Oh my goodness. Yeah, that's really bad.
It just hammers home the need for extreme care. Safety, really high standards, proper regulation. These things are critical. It's not like letting ChatGPT write an essay. The stakes are so much higher.
And you mentioned bias earlier. Is that a known issue with these mental health bots?
It can be. Just like other AIs trained on broad internet data, they can sometimes regurgitate harmful stereotypes, including racist medical tropes.
Wow.
And there are concerns they might just not work as well for everyone, maybe fail certain demographics, like, say, Black Americans, if the training data wasn't representative.
So effectiveness isn't guaranteed, and there are real safety risks. What do the experts think AI is good for right now in mental health?
Well, Rob Morris from Coco Cares had a more, let's say, grounded take. He suggested the best immediate use for AI is probably administrative stuff.
Like scheduling or paperwork?
Exactly. Things that free up human therapists' time so they can actually spend more time with patients, doing the human part of the job.
That makes sense. Let AI handle the admin.
And interestingly, Coco actually tried integrating ChatGPT to help co-write messages on their platform.
How did they go?
Not well. They got significant pushback from users. People seem to really prefer knowing the messages came purely from another human.
So they had to pull back on the AI integration.
Yeah, they scaled it back. It suggests a strong user preference for genuine human connection, especially in that kind of peer support context.
Which loops back to that point Richard Lewis made, doesn't it?
It really does. His point was powerful.
Yeah.
People in distress, they don't just need to be fixed like a machine. They need to feel seen, heard. genuinely cared for.
Yeah, that connection piece.
That human connection. And that's something current AI, for all its pattern recognition, just struggles to replicate authentically.
So, okay, as we wrap up this deep dive, we're sort of left with this real tension, aren't we?
Definitely.
On one side, you've got this exciting potential AI, maybe boosting access, helping with monitoring, perhaps even spotting issues early.
Yeah, the promise is there.
But then on the other side, these huge questions about AI's limits in understanding us, the need for really robust safety, and just the fundamental value of that human-to-human element in mental health care.
Precisely. It's clear that while AI offers some, interesting possibilities, maybe even some helpful tools down the line,
It's not a magic bullet.
not at all. It's not a panacea. The experiences and the research we've looked at, they really highlight some pretty significant limitations we absolutely have to keep in mind.
Okay, so building on all that, here's maybe something for you, the listener, to chew on, thinking about everything we've discussed. What are those absolutely core parts of human connection, of empathy, that are just essential for supporting mental well-being?
Good question.
And maybe, how might technology, as it keeps evolving, potentially challenge those core needs, but also perhaps find ways to complement them? Something to think about. Thanks for diving deep with us.